Now, my next question, this is kind of first one, just building on that. Now we have competitors. Oracle Health has competitors, and good or bad, Epic is getting some good PR these days. But then that is changing. So in the last 6 months, we know that they have some issues there too. But competition is inevitable. So we are going to have that either with 1 or 5 companies. How is Oracle Health positioning itself for addressing these interoperability and clinical burnout challenges? Do you believe that technology can help for those issues, and at what level?
Great. So from a competition standpoint, Oracle Health, our competition is heart disease, diabetes, undiagnosed mental illness, problems with access. That's who we're fighting, and we hope Epic does really well against that same war. There's plenty of suffering to go around for all of us to be successful. Specifically, though, when you get into the actual strategies, I would say we have a winning strategy, and now that we've become Oracle, our Achilles heel had always been execution, and that has not only been resolved, it's blown me away. So let me give you a couple examples.
Mm-hmm.
So the first thing we need to do is fix the EHR, because if you talk to frontline docs or nurses, regardless of, I like to point out I'm the only one who's run an EHR company that's ever had to use one. And when you talk to the users, it was never built for them. It was built for billing and coding and meaningful use and all kinds of things. And there's a great story behind the why. That doesn't matter. If I'm a busy PA in an emergency room or a busy outpatient oncologist, I don't care about it. Why am I spending 2 hours at home doing my charting? So we just launched, and it's now general availability, our new electronic health record, AI-based. Let me describe it. So first of all, it's the only one that's full stack, where you go from cyber secure cloud, military grade on our Oracle stack, all the way to the end user. And it does a bunch of stuff. It's context specific. So if I came into the electronic health record as a psychiatrist and I'm on the inpatient pediatric service and I'm evaluating kids for organ transplant, some bizarre little niche, the EHR opens up, it knows who I am, it knows what I want to see. And then it does some things that no one else has been able to do, all together in an integrated fashion. So let's pretend I'm an outpatient doc and I'm going to go see my next patient. I say, hey, Oracle, tell me about my next patient. And it does, AI generated, a summary on that patient that captures information from the electronic health record, from health information exchanges, other electronic health records, and 2,000 public data sources that help me understand that patient. Things like food insecurity. I happen to be in Los Angeles right now. Am I near the fires? What's the air situation? All of that is captured in 1 or 2 paragraphs, as if you had an amazing medical student who stayed up all night summarizing your next patient. So you now got it in whatever, a millisecond. Okay, now go in the room and see the patient. And when I'm seeing the patient, they've given me permission to put my phone down to do the ambient listening like other systems have. So it's listening as we're talking and how are you feeling, is pneumonia better? But you know what? Your diabetes seems a little out of control. I can now do inquiry. So in the middle of the ambient listening, I say, hey, Oracle, tell me about patients' hemoglobin A1Cs and correlate it with when I change metformin dosing. And that's then brought to me right there. So no more looking for information. It's using your voice to do that inquiry. So we have the summary in the beginning. We have the ambient listening. We have the inquiry. And then the piece de resistance, it does all the actions. So it writes my note, writes a note to the referral. It sends a note to the patient. The patient wants a note to their sister who happens to be a nurse. It can change the language for that note. It does the billing, the coding, the scheduling. Everything is done, human in the loop in every step. So I've now seen the patient. I got a better summary than I could have done myself unless I had 4 hours. I was able to interact. I never, ever, ever took my eyes off the patient. I never went to the terminal. So when we've seen this, patients love it. They're like, oh, my doc seems like they're so less stressed. And then when I'm done with my patient, I don't go home at night to finish the record. Okay. Amazing. And then you add to that things like auto adjudication. Now that the note's done, we can actually make sure as the patient leaves the office, their bill is done. So they don't get these EOBs at home that they don't understand. They can auto adjudicate as they walk out of the clinic. You owe $15. You want to use your HSA or Venmo, like a Uber experience, right? Not only that, through this whole thing, if this patient was research appropriate, those types of clinical trials come up automatically in the electronic health record without me having to swivel over or look, does this patient qualify for an oncology trial? So that's what we say when we say fixing the electronic health record. That's out right now. And I was talking to a doc from Knoxville, Tennessee, who I met a few years ago. I go around and meet customers. There's always those people who are really, really mad at you. He was one of those, right? So this is the guy, Cerner doesn't do this, and you don't do this, and you don't do that. Now our spokesperson for this clinical digital assistant. So not only has he become, have we won him over, he said that in his practice, he actually treats quite a few retired physicians. And when he's done seeing them, he says, look what this thing just did. And many of them have said, I wouldn't have retired. So we really think this will solve that burnout piece. And when you say to head against Epic or the others, no one else can offer this fully integrated. So that's great. The second thing, which I would describe as almost greater, is we're not an anymore. We're an end-to-end platform. So this cloud-enabled platform can connect things like back office, human capital management, which is budgeting, chain, to the clinical side. Every other industry connects those things. We have never done it in healthcare. So what are the use cases? Well, let's pretend I'm a nurse and I got trained on chemo 3 years ago, but you've not been on that unit. And now I'm on the chemo unit and I'm about to give chemo for the first time. We should know that from human capital management and have just-in-time refreshing training in the EHR right as that nurse is giving chemo. I'm in the operating room. I use ambient listening and did my whole note. Great. I replaced the hip. That should actually drive supply chain so we have the right supplies there next week for the next cases. I'm a population health manager. You know what? We're down on mammography, or maybe we need a colonoscopy campaign. Hey, Oracle, help me set up a colonoscopy campaign. It shows me what the cost will be, what the staffing will be. Do we have enough rooms to do it? So this whole thing now gets connected in a way that no one else has been able to do it. So I'm not worried about the competition. I think platforms win. And when we say platform, that's what we're talking about. And then the other piece in this, and this does differentiate us from some of the other big players in electronic health records, we're going to be wide open. 300% increase in open APIs. We want all the innovators out there, because we do not think we can do this alone, to build on top of what we have, versus others who've said, no, we don't want you to do that. It's on our roadmap. We're going to build it ourselves. We are not a walled garden. We are an open, connected platform beyond just EHR. So that's what we're up to. And I've never been so excited. And the combination of becoming Oracle, which really, really accelerated our roadmap, a new kind of Gen AI that's allowing all this to happen, our amazing installed customer base that's hung in with us, now showtime for us. So we see 2025 as a banner year.